Potential changes affecting nearly 900,000 Georgians enrolled in their health care plan.
Yeah, Governor Kemp signed SB 65 today. So this calls for a state-run healthcare marketplace to replace healthcare.gov. Tonight, 11 Alive's Joe Ripley explains the impact.
Cindy Pursley recently retired as an accountant.
Insurance was an issue, and I'm a 3-time cancer survivor. With a genetic mutation.
She enrolled in the Affordable Care Act 2 years ago, using healthcare.gov to navigate her options.
And I don't have to dig through a bunch of weeds to find something that's going to cover pre-existing conditions.
Governor Kemp signed Senate Bill 65, which implements a state-based healthcare marketplace. It replaces healthcare.gov as the site Georgians visit to choose their healthcare plans, including the ACA. The online portal still needs federal approval from the Centers for Medicare and Medicaid Services. Whitney Griggs, a health policy analyst with Georgians for a Healthy Future, says the move helps the state avoid paying billions per year in fees to use healthcare.gov.
Using a state-based marketplace can customize their outreach methods, their outreach documents, their navigator programs to meet the state's needs.
The state previously tried a similar initiative back in 2019 called GeorgiaAccess.com, where people could learn more about healthcare options in Georgia. Greg says the proposal was approved by the Trump administration but suspended by the Biden administration. Greg says 18 other states have implemented similar state-run sites, and they've been mostly successful, but with nearly 879,000 people currently enrolled through healthcare.gov and Georgia reevaluating Medicaid, Greg says the state needs to invest more funding, training, and education for customers before the state site goes live.
We have one of the highest uninsured rates in the country, and there's a variety of reasons for that, but we need to make sure that we're not increasing the number of people that are uninsured.
Pursley says she's concerned about picking the wrong plan or getting kicked off her coverage with the transition to a state-run healthcare marketplace, but hopes for improvements along the way.
If I could adjust it when I know something's going to change, that would be nice. And, even if the premium goes up.
Joe Ripley, 11 Alive News.